Welcome back to our Bluesy Water channel. Today I'd like to do a video on the thyroid. I spent a lot of years examining the thyroid, doing a lot of natural therapies for the thyroid, and I recently decided to go on what's called thyroid medication. I'm using a natural animal version. So I was using thyroid glandulars. The only difference between taking a glandular and the medication that's animal derived is that you know exactly how much you're getting per tablet. With animal glandulars like thyroid glandular, which I've been using, you just don't know what's in there. So you're kind of guessing. So I decided based on symptoms to go on some low dose right now thyroid medication. And symptoms is very important. When you're trying to figure out thyroid issues, I want to put out a couple of quick points. Number one, many people who go on psych meds, depression or anxiety or whatever, a lot of times there's an imbalanced thyroid activity, and this is not going to solve your problem. So a lot of times, if you're not diagnosed properly, you can go on psych meds for what's basically a thyroid problem. So it's important to Google symptoms, low thyroid and high thyroid symptoms. Okay, so here are the signs of hypothyroidism, fatigue. You're running cold all the time, constipation, dry skin, weight gain, puffy face, hoarseness. Mental confusion is a big one. Depression, impaired memory. Hypothyroid symptoms, high thyroid, unintentional weight loss. You're not gaining weight, you're losing weight, rapid heartbeat, anxiety, pounding in your heart, increased appetite, anxiety, here we go, nervousness. Goiter, muscle weakness, insomnia, skin thinning, fine brittle hair. So basically, you know, hyper is literally hyper, overactive. This is the regulators, like the thermostat in your body, the thyroid. So if it's under, you're going to be sluggish. If it's over, you're going to be anxious and overactive. You want to be obviously in the middle. Okay, so one of the things I started doing many years ago was David Brownstein's iodine protocol. He claims that will work on helping to balance the thyroid. I will say, you know, I did that for years. I technically test normal, low normal, but normal. But if you go to a bioidentical hormone doctor, they're going to tell you that's not normal. Now, they're going to look at your symptoms, but if you come in at where I was, at 2.5 on the T3, they want you more like at a 4. So you got to understand that you could go to a regular doctor and they say, you're just fine, your thyroid's fine, and you're feeling like crap. And you go to another doctor and they tell you, aha, your thyroid's low, we need to put you on that T3. So it's very important, number one, to go by symptoms, and number two, to find a doctor that supports lab numbers that are more, I would say, realistic. The normal range, just to say, is very generous in the regular lab reports. So I would encourage anybody who's questioning whether their endocrine gland system is not working properly, their hormones particularly, to go to a hormone doctor. And they're called bioidentical hormone doctors. So you have to Google that. Now, insurance will cover this, but you just have to check with your insurance plan. So just once again, remember, a regular primary care doctor might say you're fine, and you're not feeling fine. So find a doctor that supports, let's just say, a different interpretation of lab work. All righty, so natural things to do. One is iodine. Get toxins like heavy metals and chemicals will aggravate the thyroid. Bromine, chlorine, and fluorine are the competing halides that wreak havoc on the thyroid. So you're drinking city water, it's not, or swimming in a swimming pool, chlorine pool, not good for the thyroid. Iodine is the food of the thyroid. The whole Brownstein methodology is that the iodine pushes out the bromine, chlorine, and fluorine out of your body. Now, Bluesy water removes all environmental toxins, metals, chemicals. I've been doing that for years. So I've done the detox. I've done the iodine, the food for the thyroid. I've done whole laser therapy on the thyroid, essential oils on the thyroid. I've done the mission coil on the thyroid, which is this new therapy we have, which is extraordinary. In the literature for mission coil, it says it's good for hyperthyroid, but for hypo. So the bottom line is, I believe, because my mom and dad were both low thyroid, it's just genetics. And now when I played a lot of tennis, a lot of sunlight and exercise and vitamin D and tyrosine, there's a whole routine of supplements you can do. I've done probably everything I know, but bottom line is, it runs in my family. I don't put out enough T3, and according to the blood type diet book, blood type O's tend to run low thyroid anyhow. If you want to go natural, do the iodine, eat well, eliminate bromine, chlorine, and fluorine, and do a lot of exercise. That will maintain. If you're young and you're really working out all the time, that's fine. If your lab work still comes in that the free T3 is borderline low according to the bioidentical hormone doctor, I'd say do a wee bit of, just from my experience all these years, I think it's congenital. It's up to you, but if you start to feel any symptoms, you can do a wee bit of the animal sourced thyroid medications. I prefer the animal myself. That would be Armor, Nature's Thyroid, which is I think been on recall for a while. I don't know. And the one I'm using is called MP Thyroid. They're all animal derived. The synthetics, I'm not as big a fan of. So think of it this way: if you believe in glandulars, you're taking glandulars. This is just really taking another glandular. If you're going to take testosterone or DHEA, or so augmenting that way, it's just another hormone you're taking. I was stubborn. I thought I could do this naturally, and I did to some. I kept it within that so-called normal range, but I finally said, no, it's time to do it. I had to quit playing tennis for a while because I just did so much tennis that I had to heal up my body. So that was part of the problem. As long as I played a lot of tennis, I was sort of maintaining. But honestly, now looking back, I probably should have 20, 30 years ago started doing this. But I learned a lot along the way about how to support this naturally. And it's always good to try that first. And who knows, maybe one day they'll figure out a genetic tweak so that your thyroid gland goes back to producing abundant amounts of T3 to keep you healthy. So any questions regarding any program for the endocrine gland system? We didn't even discuss the adrenals. By the way, the mission coil, which we have discussed recently, you treat the kidneys, that's kidney adrenals, really good protocol for the adrenal system. And we can give you a whole program for the adrenal system, the limbic system, and the thyroid. The endocrine gland system is a huge piece of feeling good and balanced and overall health. And it's probably one of the most vital systems in the body, that and the nervous system. And they work hand in hand. All right, if you have any questions, please contact me, Andrew at bluesywater.com. Thank you.